I have. I just don't do it. I just don't do it every day.
So simple. I told you. See, that's why I have to be talking, because you don't be listening.
I'm one of them patients you talk about that don't partner with you.
Well, you are a little bit more compliant than a lot of my others. I'll tell you that.
But I'm still non-compliant, basically.
Right.
Oh.
But you need to do it at least 2 times a day, but really 3 or more would be ideal.
Mm-hmm.
Oh,
Wow.
Yeah. In the morning when you wake up, and at night before you go to bed, and sometime during the middle of the day. At least 1 time during the middle of the day.
Good evening. If you just joined in, or even if you join in tomorrow, next week, today is Tuesday, January the 5th, and you just walked in on Dr. Fowler giving me instructions on what to do. Take care of my arm. We're just having, this is Colloquies with Michelle, and that's what we do. We have conversations. And so today I am excited because we're going to be talking about stroke and the circulatory and respiratory and the respiratory system today. And we have as our guest, Abena Antwih, also known as Umi Mawu. So you may hear an interchange in regards to how we refer to her. She's here with us today. Yay, Umi. And we're going to just talk about, again, strokes, the circulatory system and respiratory system. If you have any questions, you're welcome to put your questions in YouTube. And prayerfully, we will attempt to answer the questions that you may have, even after this video is aired, because this is a live recording, but you all can always go back, and some people will access this video down the road. So I just want to say thank you, Dr. Williams and Dr. Fowler.
Thank you for having me
as well. Thank you, Umi Mawu, for being here.
Thank you for having me. I'm excited.
Yeah, I am too. So where do we start? So today we're talking about stroke, and can you just kind of tell us what it is? Dr. Williams and Dr. Fowler, what is a stroke?
So a stroke occurs, there is a blockage, typically in the arteries that is supplying the brain with blood. And as you know, the blood carries the nutrients, again, the oxygen and all that. And so that's basically it. When there is a blockage or a slowdown, let's just say, it may not be a complete blockage. That's basically what a stroke is.
Yeah. So to add to that, there's 2 major types of stroke, and I see you sharing your screen, Ms. Simmons. You got some great information for us. 2 major types of stroke. One being your ischemic stroke, which relates to what Dr. Fowler was just saying. That's the stroke where you are having a disruption of proper blood flow. That blood flow is being cut off, okay, which is causing, which will cause that type of stroke. Second major type of stroke is a hemorrhagic stroke, right? And that's almost the opposite happening, whereas there is essentially a bursting of that vessel, whereas that blood is no longer flowing.
Right.
So those are the 2 major types of strokes that we commonly see in society.
And let me add one more to that too. There's, as Doc said, there are 2 major ones, but there's a third one that is, for some people, not considered major, but a stroke is a stroke is a stroke. And that is a transient ischemic attack, a TIA. And it is actually considered a mini stroke. But the difference between this TIA and the ischemic, the major stroke, is the TIA only lasts approximately 5 minutes or less. But again, this is actually seen as a precursor to a major stroke, and we will get into that a little bit later.
Let me ask you a question then. So if someone were to have a mini stroke, can a person have a mini stroke and just continue on with their day-to-day life?
Absolutely. And because it is a mini stroke, some of the effects of which, the typical effects that you would have from a stroke, may not as visible, if you will, it suffers a TIA, or they may have symptoms of a stroke that are temporary. And then, full function, nerve, motor, sensory is then, randomly restored.
Mhm.
Yeah, to answer your question, because it's considered a mini strokes, a
Mhm.
stroke, you can argue that the effects are considered many as well.
Right.
Wow. Okay. And so I'm not sure which one is what is ischemic stroke or hemorrhagic stroke, but are some of them caused by brain trauma or brain tumors?
Mhm.
Yes, that
Yeah.
can be one of the causes of a stroke, because
Right.
obviously if you have a tumor
Mhm.
that's essentially sitting on or encroaching on a vessel and thereby cutting off that blood flow, then obviously that could have caused especially your ischemic type stroke. Or you may have a trauma,
Right.
right?
Mhm.
A blow to the head or something to that effect that can either cause either one of those types. It can shunt off blood flow, or it can cause the rupture of a blood vessel. So a trauma could cause either one of those types of strokes.
Right. And the ischemic stroke is the most common. Most people, when they have a stroke, they get the ischemic stroke.
Okay. So is it possible that someone can have an injury to their head, a
Mhm.
trauma happen,
Mhm.
and they not even realize the impact over time? And because of that trauma, let's say someone had a head injury, a car accident, or just bumped their head, coming up, and there was a cabinet open. And there was a big time lapse. And then all of a sudden they have a stroke. Is that a likelihood as well?
Yes, that definitely is a likelihood. So, kind of what you're describing a little bit of is a, concussion. And I know that's a topic for another day, but since you brought it up, we'll just go into it just for a little bit. But when
Yeah.
you have a head trauma,
Mhm.
where it causes a concussion, that is basically where the brain is being thrown around in the skull, is hitting up against the skull. So when that happens, you actually can disconnect the nerves in the brain. When the nerves are disconnected,
Mhm.
they start to die. All right. And then again, as chiropractors, we take care of the nervous system. So the nervous system runs your entire body. If you're not getting proper nerve information going everywhere in your body, then it can cause defects, weakness, an environment that is not conducive to the pressures that is in the vascular system, which can cause, for example, a hemorrhagic stroke.
Hmm. So what is an aneurysm then? We talked about brain trauma, we talked about brain tumors. What's an aneurysm?
So an aneurysm is essentially where a blood vessel can become malformed, if you will. It
Mhm.
is an interruption of blood flow per se, but it is not a full-on stroke.
Mhm.
So there could be some plaquing in the blood vessel that has caused an alteration of blood flow, if you will, but it's not a full-on stroke where that the blood flow is completely being shunted off or
Mhm.
disrupted, like which occurs in a stroke.
So think of
Okay.
it as being, and this may not be as pleasing to describe, but think of it, aneurysm as being like a pimple. When a pimple rises in the skin,
Mhm.
it's actually extending the integumentary system, and which is the skin. All right, and so unless you pop it or do something else to it, it will stay there until the body dissolves it. And so this is actually what happens with aneurysms. They actually swell the artery, and now sometimes the body can get rid of them itself. All
Mhm.
right. But again, that goes back to the environment that is created. And again, proper exercise, proper nutrition, proper rest, and of course, proper chiropractic care will make sure that you have the proper environment.
Right. And now, and also to your question, Ms. Simmons, now an aneurysm can be a precursor to a stroke.
Yes.
Because obviously, as that vessel dilates and expands because of that aneurysm, it can cause the vessel walls to become weakened, and thereby can cause that vessel wall to give way and can cause a hemorrhagic type stroke that we've already discussed.
Mm-hmm.
Okay. So I want to do this because you all use some words that some people might not understand. Like plaque, you said shunt, Can you kind of explain what that is in like layman's terms, for those that might not know what all of that means? What does it mean to have plaque?
Let's break it down a little bit. All right.
Yeah.
So when we're talking about plaquing of the vessels, that is a buildup of cholesterol.
Right.
Okay. So that kind of goes to the conversation about diet. And we talked about diet, as it relates to the onset of heart disease, stroke, all of that is interrelated. So when we're having a conversation about diet, you want to make sure that, you're eating healthy foods, green leafy vegetables, fruits, fibers, whole grains, things of that nature. You want to cut down on your fatty foods, your greasy foods, your junk foods, your processed foods, any foods that are high in cholesterol, right?
Right.
And what cholesterol does in our blood is it sticks to the walls of the blood vessels. And over time, that cholesterol can continue to collect and collect and collect to where it can cause a blockage. All right. That's when you're talking about your ischemic stroke. So when we're talking about plaquing, we're talking about that collection of cholesterol within the walls of the blood vessels, which initially can cause high blood pressure, but over time, that increase in plaquing can lead to stroke and other things as well too. And we were talking about, so you mentioned plaquing. What else was that you mentioned?
You mentioned a shunt.
Okay, shunt. So when we're talking about, well, I'll let Dr. Fowler mention shunt.
Okay. So a shunt, just look at that as basically a way to get around a blockage. Okay. There are different kinds of shunts, and so to let's just say make it where the body can continue to operate like it needs to. An apparatus, and again, there are different kinds. You have a mesh shunt. They now actually are using sheets now, which is another form of a shunt where they actually peel the artery back, put this material around the artery as opposed to putting it inside the artery, because a shunt actually goes in the artery and it helps to open up and break up the plaque, the buildup. But sheath is actually put around. Once they go in, they open the artery out, clean it out, then they put this sheath around it. And so that could be looked at as another form of a shunt too. So basically a shunt is a way to get around a blockage, kind of like we do when we go on 285 and it's locked up here in Atlanta, and we get off on the side roads to get around it.
Right. So question, once plaque is built up on the arteries, is there a way that we can naturally reverse that through our diet and through exercise, or do we have to go to a doctor and be prescribed medication or anything like that to remove it?
Well, you just said it. Diet and exercise is one of the primary things that we can do to help lower cholesterol. And that's basically what that is. When you have high cholesterol, which, when you break down your cholesterol numbers, when we say we have high cholesterol, that means we have a high LDL, which stands for low density lipo protein.
Right.
Okay. That is the type of protein that is less dense. Therefore, when we say less dense, is not as heavy, so it's more free flowing, and it has a tendency to stick to the walls of our blood vessels.
Right. So
when that number gets high, when that LDL number gets high, that's when we have the quote unquote high cholesterol. In order to reverse that, exercise is key. Cardiovascular exercise, a brisk walk, a bike ride, something to that effect. Anything that's going to increase your heart rate for a minimum of a 30 to 45 minute duration, at least 3 to 4 days per week. What that does is when you increase that blood flow, increase that blood pressure with exercise, that's like taking a pressure washer, if you will, to your blood, the walls of your blood vessels. That's going to help to clean a lot of that excess cholesterol and those lipoproteins away, and then they get dissolved in the liver.
That's real good. I like that. I like how you explained that. Go ahead, Doctor. You want to say something?
No, that's it. That's it. Exactly right. When So he talked about the LDL, and of course, what doctors talk about that you want to have is the HDL, because again, they do not apply as readily to the walls of the artery, and so like Doc said, we can do things like exercise, eating right, drinking plenty of water, and not colored water, Kool-Aid, tea, lemonade. I'm talking about straight water. Drink just straight water, because the body does not have to use any energy when you're drinking water. It goes straight to the system. And so this just goes back to what we say in the office, and that is God put in us what we need to heal. We just have to get out the way. And eating properly, sleeping, and all that helps to get out the way.
You know what? And in the midst of COVID, we're hearing about folks gaining all of this weight, right? Because folks are just eating, and a lot of it is stress eating, nervous eating, anxiety eating. There's a lot going on in all of our lives, and how important it is for us to still get out and move. I have to do that.
Yes.
And it's a struggle. I understand, like, I'll sit out on the porch and sit in the sun, but I need to physically move my body. And it's honestly a challenge for me to do that, and I don't eat a particular way all the time, but I do indulge. But it's definitely necessary for us to do that. There's so much we can go into, because you mentioned cholesterol, but you also mentioned high blood pressure and the correlation between that. Because I thought that when the blood pressure increases, when people have high blood pressure, that can does that thin the arteries?
It can.
Yeah,
it can very much.
Yeah.
So when we're talking about, we just talked about aneurysms. That's one of the things that can lead to the aneurysm, because that constant high pressure within the vessel can cause that vessel wall to weaken, causes to the blood vessel to balloon, which in and of itself, that is the aneurysm. Or just as we're mentioning, the sustained high pressure can cause the stroke. Things of that nature can put extra pressure on the heart. So when we're talking heart disease, we're talking heart failure, all of those things are all interrelated. So, you mentioned the pandemic. Stress is a factor. Stress weighs in when we're talking about, the health of our heart, the health of our body, and our internal organs as a whole. And this pandemic has weighed heavily on a lot of people for obvious reasons. You have folks that are, without a job, worried about the roof over their head, providing for their children, paying their bills and things like that. Or, they're working from home or not working at all. So we're sedentary, we're inside our homes, and our homes have now become our cage, if you will. Many of us are afraid to step outside that door for fear of what's on the other side. So that has caused a shift in how many of us are living. And unfortunately, that shift has trended negative when we're talking about lack of exercise, lack of quality eating. That may be affecting how we're sleeping, the quality of sleep that we're getting every night, the duration of our sleep, stress and anxiety, so all of that has a cyclical effect when it comes to our overall health. But even so, when we're talking about blood pressure, things of that nature, all of that has effect.
And so what we have been talking about, without actually saying it, is we have been talking about the circulatory system. All right. Again, because this system circulates the blood throughout the body by using the different vascular vessels. And so one thing was kind of hinted on, but not really touched, was where we started talking about arteriosclerosis or atherosclerosis. All right. And there's a difference. For example, athero, ATH sclerosis, that is the hardening of the artery due to plaque buildup. We just talked about plaque. Arterial, APR, or ART rather, I'm sorry, that is talking about hardening of the artery due to lack of elasticity. And again, all that pressure going back and forth when it's not right, it can cause the artery to not be able to hold the pressure and cause a situation to come about.
Let me ask you a question. Can high blood pressure, can it be mutually exclusive that it's not, can high blood pressure not be a factor when it comes to weight? Like weight is not an issue, whether you're overweight, on target, or below weight, you can still have a high blood pressure. It can still impact you negatively, and you can still have a stroke, whether it's genetic or environmentally caused.
Right, absolutely, because the end result is the same, right?
Yeah.
What may cause it may differ. You know, you mentioned it could be hereditary, it could be genetic,
Right.
it could be stress. You know, you have, you know, a person that you might look at and say, oh, they're the pillar of health. You know, they may be fit, you know, they may be young, they may be limber, but their pressure may be higher than, you know, someone else that you might feel that does not fit that criteria. I say all of that to say many different things can cause high blood pressure or any other ailment for that matter, but whatever, despite the cause, the results are going to be the same.
Right. But it's one of those old adages, you know, you can't judge a book by its cover, because just because you look healthy does not mean that you are.
You're right. Listen, that's good. All right. So Umi Mawu, how are you this evening?
I'm good. I'm just really listening and learning a lot, you know, because I am one who has had a stroke about 3 or 4 years ago, and it's affected my life in so many ways. So I'm now at a place where I can cognitively function a little bit better. You know, I spent, and I'm still spending some time feeling like the stroke really affected my cognitive abilities, you know, because in all arrogance, I used to think I was one of the most brilliant people in the world. But right now I'm like, uh-oh, I don't know. And I feel like, you know, I feel like it's because of the stroke. Some of my sensory abilities, my vocabulary, a lot of things have altered and changed. So I listening to the doctors explain what is a stroke, that I'm listening like, wow, I've never heard this, but I can't guarantee that I've never heard this. I may have heard it within this 4-year recovery time, but just don't remember, because that's something that happened to me also as a symptom of the stroke. A lot of what they're saying, I'm now trying to think about how it has affected how the stroke affected my life. You know, academically, I don't know all the stuff the doctors know, right? I know what I have lived through and what I'm struggling through now, and what I have survived, to be quite honest, because the other thing is, you know, as awful as I have felt about survival and rehabilitation during the stroke, that is not the most awful thing that could have happened to me. In truth, it's not the most awful thing that has happened to me. It's a blessing, really, that I'm still here. You know, it's a blessing because I was, as I've heard people say, I was really young when I had my stroke. I was 42, 43, something like that.
Yeah.
And everyone says that's a very young age to have a stroke, you know, so, I've been trying to listen and learn as I rehabilitate and try to get myself back to where I was. I'm not there now, but I'm hoping I'm getting there. And it's awful, you know. So I'm saying to anyone else who's listening, don't be like me. Don't hear all of the warnings. Oh, eat less. Oh, eat differently. Oh, work out. Oh, don't hear all of those things and skip by them. Or do a really good workout in March and think you're good for the rest of the year. That is not what they're saying. The doctors are suggesting that working out become a process of how you live. Something you do, you just do it. Not that you plan, well, for some people, they have to plan it for their lives, but really you want to get up and just actively live life, and working out and eating well is a part of how you live life. That's a goal for all of us as we try to learn and live life differently to prevent some of these issues, these interrupters that happen in life, you know? So I'm thinking a lot, I'm responding a lot, even if I don't say anything, it's really affecting me.
Thank you so much for sharing.
And
Doctor?
yeah, I was gonna say what the sister is talking about is well, when she's talking about don't ignore the advice and warnings about how to eat and all that kind of stuff. So what she's talking about is wellness and maintenance. You know, wellness is the process of choosing to live healthy, a healthy and well life. All right. But again, like she said, you can't just work out one time in March or 1 week in March or 1 month and then think the rest of the year is going to be okay. So now we're talking about going from wellness to maintenance. And maintenance is just basically adding what you're doing, like she was just talking about the workout, making that a part of your lifestyle.
Right.
You have to choose. We have to choose. We as Black people especially have to choose intentionally to be healthy, because we have encountered so many ill situations that have brought upon us, like lack of funding, lack of health care, all that kind of stuff. So it sets us up to have ill health or not to have the proper environment within. So we have to be intentional when we do this. We have to make it where, okay, oh yeah, I might work 12 hours a day, but you have to find some time outside of that 12 hours to eat right, exercise, go see your chiropractor.
And Dr. Fowler touched on a key word that I want us to spend some time on, and it's lifestyle, right? A lifestyle can take on many meanings. It could be a good thing or it can be a bad thing, but whatever our lifestyle, it will affect our overall health for good or for bad. You know, so we have to, you know, when we're talking about diet, when we're talking about exercise, when we're talking about proper rest, and of course, when we're talking about chiropractic care, all of these things are the things that are going to allow us and afford us to have a healthy lifestyle. A healthy lifestyle is what's going to lead us to longevity and add life to our years, right? In the previous conversation, I said, you know, as a society, we've gotten good about adding years to life, but now we need to get good about adding life to those years, right? So that's where healthy lifestyle and healthy living comes into play.
Okay. Umi, do you happen to know or remember what type of stroke you had?
You know, I was asking myself as they were talking, I don't know at all. And I still don't know because the doctors, I think, let me say this. I think someone tried to explain to me what happened initially, right? But what I'm learning is that initially I just wasn't in a place where I could respond and keep such information. So now what I know is they thought that there are a lot of different suggestions about what might have happened to cause my stroke. I've been a diabetic and high blood pressure. Both of those things can come together and create conditions for a stroke. There's some discussion about me having MS. I was, what? Me? I still feel that way. But that's a possible condition. And then they say that I have some issue with my pituitary gland. So any one of these 4 reasons can be something that led to my stroke. But what I can say, claim my own self-care, is I was one who was not healthy. I didn't have a consistently healthy lifestyle. I was constantly overeating. I was not working out with any kind of regularity at all. So I can see that those behaviors contributed to my my position. I didn't know how bad it would affect me then, but now I do.
So you had initially, when the stroke happened, the doctors had 2 diagnoses. They hadn't, like when you were admitted into the hospital, they were trying to figure out whether it was MS or a stroke? Do you know how long that it took for them? And I want to know, Doc, if you happen to know why it would take two diagnoses, why would they waver between two diagnoses, multiple sclerosis or a stroke, and how long it took for them to definitively say, and if they know even today that you definitely had a stroke?
So
You're asking me? Oh, okay.
you were talking to who?
I was asking Umi at first.
Okay, I'm
like,
sorry.
The time frame that it took for them to actually tell it, because at first it was like, from what I remember, they were saying, well, she may have either a stroke or MS, and then it was like she had MS, and then they said no, she actually had a stroke.
Right. So I don't believe they have solidly identified a reason for my stroke. No one's ever said to me, you don't have MS. No one has explained to me exactly what MS is, how long you can have it. Can you have it for one day or one moment and not have, I don't know any of that. And I've not done a good job of asking those questions prior to this point. Right? So I don't know. But they were concerned about that as an option for a long time during my, well, what I thought was a long time during my recovery. And then they just stopped asking about it. I guess I stopped showing symptoms or evidence that I had it. But I'd love to hear what the doctors have to say about that kind of instance, as I'm in the season now where I'm seeking more information.
Yeah, so a lot of the ailments that we encounter as humans have similar symptoms, and it's just maybe one or maybe two symptoms for each different disease that may separate it from the others. And so when you're coming across a situation where they're saying, well, could it be a stroke, could it be MS, could it be hypertension, whatever, a lot of those have similar symptoms. And so what they're doing is, as they're going through the process of coming up with a correct diagnosis, they're trying to see if one symptom will put his head up, just to say, more than the other. All right. And the ones that present themselves more than the other will help to distinguish what it is. And so, again, when we're talking about environment, because that's what we're talking about, creating the proper environment within, so that your body can operate the way God intended for it to. And so you are not doing the healthy things like eating right and exercise consistently. And see, that's another thing. We're talking about being consistent. Then it does not allow your body to be able to fight off anything. Again, I keep saying, God put in us what we need to heal. We just have to get out the way. Part of getting out the way is not consistently having or exhibiting bad habits, yeah.
So and to Ms. Antwih's point, and as Dr. Fowler was saying, a lot of times, especially when you're dealing with the human body, a lot of different signs or symptoms may mimic each other and may mimic a lot of different ailments and diseases within the body. So when it comes to when we're talking about MS versus a stroke, both of which have neurological effects, right? So it's about, differentiating, okay, is it this or is it that? If you're displaying symptoms that are symptomatic of both, then at that point it's about differentiating between the two. So it could have been a factor of when I'm pretty sure at some point they did an MRI or a CT scan of your brain. It could have been that what they were seeing in the imaging was reminiscent of either or it wasn't a definitive, clear red flag popping out to say, hey, it's MS, or hey, she's had a stroke. So that's typically one of the things I would venture to say that what they were seeing at the time, as far as your testing and your imaging, this just did not stick out to them to say, all right, it's definitely this or definitely that. Right. So at that point, they've got to kind of dig a little bit deeper, investigate a little bit further to try to differentiate, to say, hey, it's this or that.
Right. And like one symptom, and I'll just say it briefly, that most of the issues that we deal with is inflammation. Inflammation is across the board. I don't care if stroke, cancer, sinus issues, is inflammation. And so if all of the issues or most of the issues we deal with is dealing with inflammation, then it can make it hard when you have not done your due diligence in keeping up with a healthy lifestyle.
Mhm.
You know, and then we have patients that come in and when they find out that we're able to talk the way that we talk about this, and they want to know, well, how is it that a chiropractor can handle or make better stroke? Again, we talk about this with our health talks and all that, where we're talking about eating right, right? We can give you an exercise regimen, as well as sleeping and telling you how the sleep pattern should be. But again, it all goes back to the neurological system, as Doc was talking about. If the nervous system has interference, nothing is going to work properly. And it will allow you to go through a cascade of degeneration very quick. And thereby, if something comes upon you where it had you or had your body been able to be in a healthy situation where it could fight it off, well, when you're not in a healthy situation, it cannot fight it off. You know, again, we go back, we mentioned COVID a couple of times. COVID is the elephant in the room right now. But if you have pre-existing conditions, anything can jump on you, anything.
And I want to mention, Doc just mentioned this, when we talk about, now we're getting to the chiropractic side of things.
Yeah.
And how chiropractic can help not just prevent stroke, but after a stroke, right?
Mm-hmm.
So again, we're not just talking out of the sides of our necks here. This has been researched. There was a study done in 2019, so just a couple years ago, where it was found that a single chiropractic adjustment increased muscle strength and nerve signal velocity, or nerve signal strength, from the brain to the extremity. So there was a study done to where the patient received a chiropractic adjustment, right? And there was a measurement of muscle strength before the adjustment and after the adjustment. And it was found that, and the particular muscle that was tested in the body was the ankle, okay? So the strength of the ankle muscle was measured to be 65% stronger after the adjustment than it was before the adjustment. Now, mind you, the ankle or the ankle muscle was not manipulated at all. The patient's spine was adjusted. And by the spine being adjusted, it increased the strength of the ankle muscle by 65%. So that goes to show you that, one, chiropractic has a global effect when it comes to the human body, but not just in general, but specifically to the nervous system. Because as we always say, as chiropractors, we treat your nervous system. So that's where it starts and that's where it ends. But, even in the case of, when we're talking stroke, we're dealing with a neurological deficit. Miss Antwih has kind of mentioned to us some of the deficits that she's noticed since, from pre-stroke and post-stroke. So not just the neurological deficits, but muscle weakness and muscle deficits as well. Well, the nerves are what innervate and power not just our sensory system, but our motor system as well. So by receiving this chiropractic adjustment, this particular patient not only received the gains when it came to sensory, but because of the sensory gains, it also created the motor gains as well. So just one chiropractic adjustment created a 65% increase in muscle function. So imagine if you're a patient that gets under a regular chiropractic regimen, imagine what that can do for, your post-stroke recovery and, so on and so forth, when we're talking about quality of life, adding life to years, so on and so forth.
That's interesting.
Yeah.
Can I ask a question?
Yes,
Absolutely.
ma'am.
So I'm like I said, I'm 4 years in my recovery. I don't think I've had the best or the most thorough assistance for recovery, right? And now I'm at a place where I want it. For example, my reflexes are not what they used to be. I can't walk as fast, I can't turn, and I'm very nervous. But in listening to you, one of the things I have never done is I've never said, oh, I want to go see a chiropractor. Maybe that will help me get better. But is a chiropractic experience, a chiropractic visit, something I should begin to look at as I try to repair my reflexes and repair my strength, like
Absolutely, absolutely, yeah,
that.
absolutely,
Yeah.
without hesitation, absolutely,
For sure.
for the same things that I just mentioned, because at this point it's about getting that nerve function back, so when you're talking about reflexes, when you're talking about memory recall, when you're talking about muscle strength, all of those things, all of that goes back to the nervous system. So everything that we're talking about tonight goes back to the nervous system. So if we start there, right, we know that we have the ability to positively affect change in any and all of these things that we're discussing. So absolutely,
Yeah,
I would highly recommend it.
the a lot of people don't realize that the nervous system, the central nervous system, that is the first system to develop after conception. Okay. After that develops, then God wraps bone around it. For the brain, it's the skull. For the spinal cord, it's the spinal bone or vertebra. After that develops, then all the nerves to the extremities, all that comes out. All right. Then after that, all the organs develop. Heart, liver, spleen, all that. So some people have the misconception that the organs are developed first. Well, no, the first system to develop is the nervous system. So if it is the first system to develop, then it should be the system that you go back to see if whatever the issue is it starting from there, and whether it starts from there or not, making sure that it is operating properly will definitely help whatever is going on.
That's real good. Thank you so much. Thank you so much. That's so good. So we're in the middle of COVID-19.
Yes.
Have you all noticed, or do you all know if there's a higher rate of stroke because of COVID-19 infections versus influenza? Are you all aware of any study or any correlation between?
Well, as we're speaking, COVID, I'll put it to you like this: COVID is a disease that's going to be studied for years to come. We know much less about COVID-19 than we know about it. Right. Okay. So I say all that to say there's many unknowns when it comes to COVID. I will tell you this, and I touched on this earlier. This pandemic, they say it's a once in a 100-year occurrence, right? The last time something of this magnitude occurred was back in 1918 during the Spanish flu. So it's something that we as a people, at least our generation or generations around us, we've never experienced this. So this is foreign, right? So, when we're talking about stress, we're talking about anxiety, all of that factors in, right? We've had people die during this pandemic that did not die from the pandemic, right?
Yeah.
So when we're talking about increase in stress and anxiety, that increases blood pressure, right? That increases rates of stroke, that increases rates of heart attack, that increases rates of suicide, right? Because we have to think about the mental effects as well.
Yeah.
So anytime you have a global pandemic, a global event of this magnitude that has affected all walks of life. COVID is one of those things that doesn't discriminate. It doesn't care what how much money you have, how successful you are, the level of education, where you come from, who your mom and daddy is. It doesn't matter. It does not discriminate.
No respect of persons.
Exactly. So, when you're dealing with something like that, like I said, there are literally people out here right now that are afraid to step out of their front doors because they don't know what is on the other side, right? So that amount of stress and anxiety can't help but have an effect, right? But then it goes into a matter of, as Doc and I always say, how you go into a situation is a predictor of how you come out of it, right? So, when we're talking, stress and anxiety, mental health, right? Psychological health,
Right.
that is a whole nother conversation, when we're talking about a pandemic of this magnitude.
That's good. So what I want to do as we prepare to close out is just share and kind of review or clarify some of the risk factors of a stroke, just for everyone.
Okay. Yeah, so definitely, risk factors. I'll talk a little bit about some of the risk factors, and then one of the things that we, I think we touched on earlier, but we want to, clarify and make clear for everyone are the signs of stroke.
Right.
So
Okay.
I will touch on some of the risk factors, and Dr. Fowler will go into some of the signs of stroke, because going back to Ms. Antwih's point earlier, the doctors really didn't know what was going on with her. Sometimes, if God forbid, if we know someone or see someone that are exhibiting signs of stroke, and we know what those signs are, and we clearly identify those signs, that's information that can be conveyed to medical professionals, so that with that health history, with that with that information, they can make a better and informed decision. But when it comes to risk factors, we've mentioned and we've talked about diet. Diet is a huge factor. The fatty information that the junk things so that with that history, with that to that information, it can make a better and informed decision. You want to be getting when it comes to risk factors, 30 to 45 minutes. Talked about diet. Diet.
I don't hear y'all well. It's like an echo.
Something, yeah.
Yeah.
Let me try to undo something. Give me a minute. I apologize. I don't know what's open.
I don't hear y'all well.
Give me a minute. Yeah, I hear it. I'm trying to address it. What'd you say? Give me a minute. Yeah, I hear it. I'm trying to address it. I don't see the other. What did you
Yeah, I don't know if that's like a
Okay.
Oh, that's better.
Y'all hear it?
You guys hear now?
Yeah.
Okay.
It's cleared up now.
Yeah.
All right, here we go.
Gotta be versatile. That's another thing. Gotta be versatile.
There you go. All right, but yeah, so again, going back to nutrition, you want to make sure that you're eating right, cut back or just monitor, your fried food, fatty food intake, junk foods, red meat, anything, shellfish, pork, anything that's high in cholesterol, you want to, keep those at a low level. When we're talking about exercise, we're going to make sure that you're getting a minimum of 30 to 45 minutes. I like to tell people an hour of cardiovascular exercise. So when I say cardiovascular exercise, I mean riding your bike, swimming, a brisk walk, a light jog, anything that's going to get your heart rate pumping for a sustained 45-minute or so period, that's going to help to clear out a lot of that junk in your blood and your circulatory system. You want to get proper rest. I recommend 6 to 8 hours of uninterrupted sleep every night. Okay. Your body needs that to rest and rejuvenate. Okay. And repair and heal. Okay. Of course, chiropractic care is key, because we've illustrated tonight the effect that chiropractic care has on stroke patients, but just on overall health as a whole, when we're talking about sustaining the health of your nervous system and all of the other systems in the body that are offshoots of the nervous system. So those are the things that we can do here today that can help to prevent things like stroke and things like that. But of course, you got to know your numbers. So you want to, get blood work. You want to get, regular checkups to make sure that your cholesterol levels are within normal, that your blood pressure is within normal. Of course, manage your stress. That's we talked some about stress tonight. Try to keep your stress levels low. Try not to, whether it's your job, whether it's your relationships, whatever you have going on, try to keep those stress levels as low as possible, and try to remove those stressors out of your life, in whatever way you need to do that, in order so that you'll be able to sustain, your overall quality of life and health. And now I'll let Dr. Fowler talk about some of the signs of stroke, so that we as a people know what to look for, because when it comes to stroke, the earlier that we get it addressed, the better our overall outcomes are.
Right. So some of the signs of stroke are sudden numbness or weakness in the face, the arms and legs, especially on one side of the body. Another sign would be sudden confusion, or the inability to talk or understand what someone is saying to you. Another sign would be problem with vision in the eyes, for example. Another one would be having improper balance, not being able to walk. Okay. And then another one that is often talked about is a sudden and severe headache with no apparent cause. So there is an acronym that is often used just to make it easy for people to recognize the symptoms and either help themselves or help someone else. And that acronym is FAST, FAST. Now the F is for face or facial drooping. So sagging in the face. All right.
And particularly, it's going to be one side of your face. So if it's like someone is smiling on one side of their face and they're frowning or drooping on the other side of the face. So that's usually a telltale sign of a stroke.
Right. The A, again, FA is arm weakness. And so typically how you can distinguish that is you have someone to lift their arms, both arms up at the same time out to the side. And typically the side that is affected will not go up as high as the other side or the non-affected side. Okay. The S in FAST is for speech. Again, I mentioned that either you cannot speak clearly or you do not understand what someone is saying to you. So that again goes to confusion. And the last piece is time. The time is of an essence. I used to hear growing up that if you get someone that has had a stroke to the doctor or hospital within 3 hours or something like that, that they will be okay. Well, that may be true for a healthy person, but oftentimes the causes of stroke is the fact that the person is not healthy. So if your system is already compromised, you do not have 3 hours. You need to get to where you need to get to as quick as possible. And so that kind of goes back to the less talked about stroke, which is the TIA. All right. And so the American Heart Association, as well as the American Stroke Association. They, hold on one second, let me pull this up. I want to make sure I get this right. Yeah. So again, according to the American Heart Association and the American Stroke Association, more than 1/3 of people who suffer a TIA and do not get treatment, suffer a major stroke within 3 months of having a TIA. So that's why in the very beginning I say a stroke is a stroke is a stroke, and time is of the essence.
Thank you so much.
Yeah. And can I add something?
Yeah.
And not from any kind of academic knowledge or anything, but what I'm taking away from what you guys have said is that a stroke is generally the result of something that's happened over time, meaning it's not because you didn't work out on Friday that you're having a stroke.
Right.
Because you haven't worked out for 72 Fridays.
There you go.
Right.
You know, you haven't worked out for a long time. So I think one of the things that a person must include in their life is, and their physical maintenance, is an increased sense of discipline. Something consistently, doing it well over time.
There you go.
Not something that you can do one day at the party.
Right.
You do and you build into your life. So as parents, I think it's so significantly important to begin to instill the concept of discipline into our children, because them having that concept, them having that disciplined behavior strengthens their life, and helps make them healthier. So,
and that's actually great, because we should start, let's just say, from the womb to the tomb. So in other words, it actually, the healthy living should start before we even enter this earth, because the mother should be eating and doing healthy things, so that the baby, when he or she comes out, they will come out healthy. And then if the baby, as he or she grows, sees the mother and father and whoever else is around living a healthy lifestyle, that will give them the ability to have a healthy, a good healthy life, a good quality of life, not only through their adolescent and teen years, but also through their adulthood. We all know we have to die. We all know that we're going to die, but we don't have to die a terrible death because we have allowed our bodies, or I'll just say we have neglected the temple, this temple that God has given us.
You know, the saying goes, you know, as we know better, we do better. Right? So, you know, when we're talking about health, especially, or the health disparities, you know, especially in Black and Brown communities, a lot of it is honestly due to a lack of knowledge. You know, obviously there's a lack of access to healthy foods and quality healthcare, things of that nature. But a lot of it is just lack of knowledge when it comes to our health and, you know, things that plague our communities. So that is why Dr. Fowler and I are so adamant in what we do when we're, you know, educating our communities, because we have to get the knowledge out there, right? So that people know, as they know better, they will do better.
Right. That's real good. So that's where I was going in regards to closing. Does anyone else want to add anything or have anything else that each of you would like to share? Abena Antwih, do you have anything you would like to share in addition as we close out?
Yes, to the doctors, this has been an absolutely transformative experience for me, because this is the first time I met you about an hour ago.
Right.
Informed me so much, and really you've been so accessible, so down to earth and direct, you know, about the information, and made me realize that people are there for me to relate to and to learn something from them, something that will be so transformative and useful in my life. And I just want to say thank you for being those kinds of spirits who are just willing to share. You know, I don't believe you're being paid for this. I think this is all just, you
No,
sharing
we're
your
not. We're not.
right.
Well, we're getting heavenly coins. How about that?
Yes. Well, I hope these coins add up for you.
Yes, they do.
It's a blessing. And I thank you so much for being those kinds of people who are willing to share and give. Just somebody can be better. I thank you so much.
Right, and thank you, Ms. Antwih, for sharing your story and your testimony with us. It's very, we all as a community, we need to hear these types of stories. Like I said, it's not just about how we go into situations, it's about more so about how we come out of them, right? What we can glean from those situations and how we can learn and grow for them. And that is the catalyst behind the reasons of why Dr. Fowler and I do what we do. Is not for the compensation, but it's so that we can empower, our people, underserved, underrepresented communities, Black and brown communities, the ones that really need this information, and communities at large, right? At large, because it's about all of us. If this pandemic has taught us nothing else, it has taught us that we are all a large global community, and we are all, it's not just about this person over here or that person over there, but it's about all of us. So, that is why we do what we do. And Ms. Antwih, we do encourage you to try to find a chiropractor. Are you in the Atlanta area?
Yes, I'm in Cobb County.
Oh,
okay.
Wow. We need to have a conversation offline.
That's right.
Yes, we do. I'm like, where they at? Yes, I would like to know.
All right. With that said, we would like you to go to our website, and we will be reaching out to you after this conversation.
Yes.
But reach out to us at yourfinespine.com. That's yourfinespine.com. You can call us at 404-383-1110. That's 404-383-1110. We're also on social media, Twitter, Instagram, Facebook at Aligned for Life. That's Aligned 4 LIFE. So, Ms. Antwih, we look forward to seeing you in the office very soon.
Very soon.
Yes, I will be there.
Yeah.
Thank you.
And just as far as, Doc pretty much said it all. The one thing that I want to say is that there's only one race. That's the human race. And so when you have a sect of people in that race that is being affected negatively, it's no different from parts of the body. When there's something going on somewhere in the body, the other parts of the body adapt to that. The question is it adapting properly? Pain is an adaptation, but as far as we're concerned, it's an improper adaptation. So, but just back to the human race, if there's a sect of people in the race, human race, that's having ill health or whatever, other people within the human race are going to be affected, whether it be directly or indirectly. And so the last thing I'll say is, and that is, if you want to be fine, take care of your spine. We got you.
Thank you all so much. And thank you for addressing basically the socioeconomic piece when it comes to people in our health. This has been very informative. I'm grateful for you all. I'm glad. Thank you again, Umi Mawu, for being here, your participation. And I just pray that at the end of the day that someone was touched. I shared with the doctors about a week or so ago that, we are an endangered species because of the environment that we live in. And if we are ill-informed, if we don't take control over our own health and take agency over our bodies, we won't be here. We have to take care of each other. And so that's one of the reasons why I decided to just want to share and introduce people and be a bridge. I believe that God has used me to be a bridge in other areas, and just added this onto the plate. So thank you all again for being here. If you all can hold on, and we will say good night. Thank you all for tuning into Colloquies with Michelle. Our next colloquy will be Tuesday, January 19th, same time, same place, 6:30 p.m., where we will discuss the what? Dr. Williams Fowler?
Integrity system.
Listen, I'm not staying plain.
Hey, so in other words, we're going to talk about the skin.
So we look forward to seeing y'all back here, same place. Thank y'all so much. Have a great evening. Bye-bye.